And good evening, everybody, and welcome to a special meeting of the Board of Health. Go ahead.
I'm going to do roll call. Alan Ginsberg,
Here.
Carla Pohl,
Here.
Cory Tello,
Here.
Hannah Eisner,
Here.
Judy Buchanan,
Here.
Richard Janetti,
Here.
Robert Colhase,
Oh, there's somebody.
Here.
Scott Hume,
That may be him coming.
I was gonna say maybe him coming. Yeah, there he is there.
Yeah.
Scott Hume,
We didn't hear
okay, he's here. Sonia Reese,
Here.
Susan Schaefer.
I'm here.
We do have some public comment today that came in the form of emails, and so I'm going to read those to start. These are put in order of which they were received. The first one is from Dave Reynolds, and it says, "It is time for businesses to reopen. Simple rules and common sense can be implemented. Mental health is becoming a major issue, and folks need to get out. Please make this happen. Thank you for your consideration." Then we have one from Kim Tackett. "My husband Greg and I wish to ask the McLean County Health Department board members who will be reviewing the Heart of Illinois opening plan submitted by the McLean County Board to support this HOI reopening plan. After talking to many nurses and doctors in our community, along with many business owners and their employees who are in grave danger of losing their businesses and livelihoods, we feel the time has come and passed to reopen our community. The health risk in our area has been minimal, and we are now fully equipped to handle additional cases of COVID-19 as they come in. We urge you to support this HOI plan and encourage the McLean County Board to pass it. Thank you for your consideration." The next one is from Josh Barnett. "Dear Dr. Pohl and members of the Board of Health, this past Tuesday, the McLean County Board approved sending a letter to the U.S. Department of Health and Human Services and the Illinois Department of Public Health asking that the COVID-19 testing site that is housed at the Interstate Center and administered by these two departments remain here. Despite this effort and numerous phone calls made by me and other local officials, IDPH has announced that the testing site will move to Peoria this Friday afternoon. While this is a tremendous disappointment, it also provides an opportunity to local leadership and action for COVID-19 testing. I am writing to express my support for a collaborative and community-wide effort led by the McLean County Health Department to implement COVID-19 testing in Bloomington Normal. While the testing may or may not be conducted by our health department staff, they are uniquely positioned to coordinate such an effort with local health systems, social agencies, and key community partners. Availability of testing at multiple sites for the masses is not only critical to first responders, healthcare workers, and those working in businesses, but to our community and our county as a whole. The current drive-up testing site at the Interstate Center is a model that has worked well for many, but consideration should also be given to walk-up testing placed in neighborhoods with limited transportation options. I would also encourage you to contemplate a roving testing site that serves rural communities. If additional support or funding is needed to implement locally coordinated COVID-19 testing, please let me know. I stand ready to work with you and my county board colleagues to provide whatever resources are necessary to implement a robust testing plan. Thank you for your consideration of this request. We are living through a difficult situation that has forever changed our society. I appreciate you and our health department staff's dedication and service during this global pandemic. Sincerely, Josh Barnett, McLean County Board, District 10. The next one is from Marshall Elkin. We would like to direct our request to Susan Schaefer in favor of the HOI plan to open local businesses as soon as possible to prevent further deterioration to our market and community. Many businesses in this community are hurting and need quick action to put local businesses back in action. The last one comes from Chuck Erickson. To the honorable members of the Board of Health, thank you for the opportunity to address you. I will be brief. I listened to the Board of Health meeting on May 13. On 3 separate occasions, the Board of Health sought guidance from the county board. The county board has provided guidance in that we are asking you to consider the Restore Heart of Illinois plan, hereinafter HOI plan, are authored by the City of Peoria, Peoria County, and the Peoria City and County Health Department. The HOI plan is bipartisan, data-driven, and has broad support from political, business, and medical community. Bringing together Republicans, Democrats, and the businesses and medical community has not been easy in these COVID-19 days. This plan does so. It happened in Peoria County. It should happen here. The HOI plan is endorsed by the McLean County Chamber of Commerce, McLean County Farm Bureau, OSF Healthcare, Unity Point Health, and Heartland Health Services. Additionally, Peoria Health Administrator Monica Hendrickson, who helped author the HOI plan, is a trained epidemiologist. Yesterday, the governor made some minor revisions to his Restore Illinois plan. In a perfect world, he would continue to move other matters up, particularly for regions like McLean County that are further ahead. The situation is fluid and changes every day, but the reality is businesses don't have the luxury of hoping the governor makes further revisions to his plan. Some won't make it until they can reopen for indoor dining at the end of June. While I appreciate the governor being more flexible with his plan, the restaurants owners with whom I have spoken still prefer the HOI plan. As such, and for other reasons, I still believe it is a plan we should choose. It is my hope you will figure out how we can move forward with the HOI plan while still providing the residents of McLean County with testing opportunities. The county board stands ready to partner with you. Chuck Erickson, member McLean County Board, District 10, resident of the city of Bloomington. And that's all.
Thank you. Appreciate that. So just a few housekeeping issues or things. If you please keep yourselves muted until you need to speak. And then if you do the hand wave, because I've got a big Brady Bunch picture this time, so I can probably see all of you a little bit better than I could on my computer. And then after you're done speaking, then if you could mute yourself again, and that way it helps us with the background noise. I want to thank all of you for showing up and coming to this special board meeting, and I really appreciate the health department staff taking their time to come to an extra evening meeting, because I know that's not always easy to do. In terms of process, what I thought we would do is have Jessica give everybody an update, because our biggest concern is, can we support the reopening of McLean County? And we mean the health department. So we've got, when I use the word we, I'm talking about the health department. That's the way I talk. So she's going to give us an update on where we're at in terms of the 3 big issues that are in all 3 of the, in both of the plans. The Peoria plan is a lot more prescriptive in terms of metrics that we would have to be sure that we could meet if the county board decides to pass that plan. Then Mr. Knapp, who is the state's attorney, is going to talk to us a little bit about the Public Health Act, because I know a lot of you have questions about how that works, and he's the one who has the answers. And then we can have a discussion, you know, metric by metric, to see how we're doing and to make sure that we have enough capacity to support to keep McLean County residents safe and healthy. Any questions so far? Okay, Jessica.
Hi, everybody. So just a little bit of information about what we as the McLean County Health Department would need to move forward with recovery and reopening, while also still ensuring we put the health and safety of McLean County residents at the forefront of our planning. So those three things would be contact tracing, testing, and then a collaborative effort towards voluntary compliance. So I wanted to talk first about testing capacity. This is the main focus of for the McLean County Health Department in terms of reopening and looking ahead. So for the McLean County Health Department, what a robust testing capacity would not necessarily be an exact number of tests that we could give you saying that this is exactly how many tests we would want completed. It is more so we're striving to ensure there's access to testing for all symptomatic individuals, our essential workers, and especially the uninsured and underinsured populations. So an update for us is that the testing site at the Interstate Center will be continuing Saturday and on. So there's still a lot of things to work out, but what I can say is that we're coordinating with Illinois Department of Public Health to continue operating that site. But we're also, as a health department, going to continue to plan and look ahead at sustainability. So not just allowing this to be the only testing available. We want to make sure that we, again, have a robust testing capacity. So the other thing is contact tracing. So we currently have 5 staff and 1 supervisor that are trained and well-versed in contact tracing. Those 6 employees are able to comfortably manage 20 cases each when we're seeing an average daily new case total of about 3.5 to 4. So we're looking at an active caseload of 120 is a comfortable capacity for us. In May, our average active cases was 34. So again, we are still at a comfortable place for that. And some updates just as of this week, we have been notified by the Illinois Department of Public Health that we'll be receiving a substantial sum of money in a grant for contact tracing, specifically for hiring and training contact tracers, technology and equipment to augment our ongoing efforts in contact tracing and testing. So again, we are already focusing on internally beefing up our contact tracing, and we've identified at least 6 staff members that we would look to have trained to help leave the intense case investigation to our current contact tracers who are well versed in that, but then giving them some help with monitoring and with the contacts. So I guess at this time, I will let the State's Attorney's Office, Don Knapp, talk about a little bit about enforcement, since that is the other key issue that we are focused on.
Hi, thank you. So for some time now, and I couldn't tell you exactly when, I've been meeting virtually with Ms. McKnight, and Tom Anderson's been on some of those calls, chairman of the county board, Camille Rodriguez, to get a handle on exactly what my side of enforcement looks like. And we've had plenty of people ask, how would you enforce the HOI plan? How would you enforce the governor's executive order plan? As I said to the county board the other night, I've looked at the Open Adams County plan, the Madison County plan, and the more law I look at, the more determined I am that what truly will control any enforcement action I take is the Illinois Department of Public Health Act that says the IDPH and by extension the local health departments are the supreme authority in matters of isolation and quarantine and closure as well. So the process through which an enforcement action would be taken under the Illinois Department of Public Health Act is really a 3-step process. Ms. McKnight could, or anybody from the health department could, if they had in their reasonable judgment, immediate action was required to protect the public from a dangerously contagious or infectious disease, just go padlock the doors and lock the place up. And that triggers a process that I assume after that, and maybe even before that, the state's attorney's office would be involved in. before they could do that, to satisfy that burden, they would have to document the voluntary or the actions to seek voluntary compliance with whatever rule they chose to impose. And if they couldn't get voluntary compliance, then they can go lock the doors. After that, within 24 hours after that, we then have to serve, pursuant to the Act and the Administrative Code, a 24-hour written isolation or quarantine order and notice on the person. That notice has 11 different requirements in that notice. And part of that is that the people are entitled to counsel, and they're entitled to counsel paid for by the government if they're indigent. But it also, the last part of that 24-hour written notice says that it has to include a statement that at any time while an isolation, quarantine, or closure order is in effect, persons under isolation, quarantine, or closure may request a hearing to review the isolation, quarantine, or closure order under the Illinois Administrative Code. So the first two steps are, well, I should say the original step is seeking voluntary compliance. Should that not work, then the health department could literally padlock the doors. That triggers a 24-hour written notice, and that also triggers a 48-hour petition having to be filed in the circuit court within 48 hours to keep the person or group of persons isolated, quarantined, or a business closed. I've been very upfront with Ms. McKnight about the legal standards necessary to plead at the court to obtain relief under the Illinois Department of Public Health Act, what we would have to plead. And they are incredibly stringent, as one would imagine they should be if we're going to take somebody's liberty away or close somebody's business down. And part of those pleading requirements are that we have to prove by clear and convincing evidence that there is no less restrictive means necessary to stop the spread of the dangerously infectious and contagious disease. So I've got literally, and it's been developed over some time now, a checklist of exactly what evidence I would need to satisfy that pleading requirement before I go in and file a petition. I believe that following the Illinois Department of Public Health Act affords everybody due process, and I don't know that anybody's ever been sanctioned for following the Illinois Department of Public Health Act. Can I envision scenarios in which violating the governor's executive order or violating the Heart of Illinois, the Restore Illinois plan or the Heart of Illinois plan also allow me to file that petition? Absolutely. Can I envision scenarios in which a technical violation of one or the other is nowhere near enough evidence to file that petition? Absolutely. In fact, as 300 or 400 people were on a call with the director of the Illinois State Police just moments ago from 4 to 5 today, he was specifically asked, he's the director of the Illinois State Police and the former St. Clair County State's Attorney, whether a violation of the governor's Restore Illinois plan in and of itself was enough to secure a closure order under the Illinois Department of Public Health Act. And he said unequivocally, no. The Illinois Department of Public Health Act says by clear and convincing evidence, there's a number of things that need to be proven. And should Ms. McKnight or Mr. Anderson, who's kept this community safe from salmonella and all kinds of diseases forever, or Kathy Coverston Anderson, who's a Harvard-educated disease specialist, should they call me and say that that evidence exists? Absolutely, we'd seek to enforce that act and look at the elements needed to be pled. So that's about all I have. Dr. Pohl, I know you don't like to be called doctor, but we'll call you doctor anyway. I'd be happy to answer any questions. And it's hard for me to sit here and look at Dr. Ginsburg because about a year ago today, he was keeping my mom alive, and it's a tough time. But anyway, what other questions I have?
Who has questions? He's the one to ask so that we're clear, not me. Go ahead, Hannah.
Hi, Don, and thanks for that great information. Sounds like it'd be pretty difficult to enforce violations. My question, and I think there's been some asked, and I think you alluded to it at the end of the county board meeting, was whether we have the authority to enact a plan that is less stringent than the states right now? I mean, is there authority for doing that? And are there consequences to us if we were to proceed with doing that? I know in the county's code for health departments, it indicates that, you know, one of the roles of the health department is to deal with communicable disease, but in ways not inconsistent with regulations from the State Department of Public Health. So, you know, I'd like some comfort level to know that as we venture down this road, that we wouldn't risk the loss of grant funds or, you know, I mean, that looms out there, the threats of
Absolutely.
taking
So-
action. You had a chance to look into
Right.
that?
And I think that, sorry to interrupt, I think that section of the Board of Health's enabling legislation in 25013 talks about not taking action inconsistent or forcing you to take action consistent with regulations of the Illinois Department of Public Health. And my response to that, while I haven't read everything, I've read an amazing amount, is what actual regulation of the Illinois Department of Public Health has been passed. It's my understanding, and again, we're trying to prep for 3 murder trials in June, so I've spent a good amount of time on this, but I certainly haven't read everything there is that the only regulation passed by the Illinois Department of Public Health was the emergency rule, making it a Class A misdemeanor to violate 3 edicts, and that lasted for all of 6 days. So it's also my understanding, and this may be wrong, but I think it's right, that Restore Illinois is not in the administrative code anywhere. And in fact, it may not necessarily even be in the executive order. So if the Illinois Department of Public Health would like to sanction us for violating one of their regulations, I'd recommend that they actually make that a regulation. They obviously know the process to make an emergency rule because they made one for 6 days, and they could make Restore Illinois an emergency rule right now. They could be doing it right now. For all we know, what I've read you is the status of the law as it stands now with the legislature in session. It could change. Regarding your funding, Hannah, I have seen all the threats, and of course, the governor probably has the ability to pull various funding from the health department. But I'll be honest with you, I've reminded board members of the Board of Health, and I've reminded people at the health department that last I looked, the property tax levy for the health fund was $3.66 million out of a $9 million budget. The levy for IMRF and FICA is more than that. So the county board also has some ability to pull funding from the Board of Health. I don't think it's wise to, in the middle of a pandemic, do that, but I notice that it's not John McIntyre beating his chest saying, we're going to pull funding. He's saying, let's have a conversation. And it's other people threatening to pull funding. So absolutely, there is a risk that not abiding in lockstep to the governor's wishes could have significant consequences. But there are going to be plenty of consequences. And the one thing I can guarantee about COVID-19 is it is going to be the full Lawyer Employment Act for the next 10 years, because we're going to be litigating all of these issues for a long time.
Thanks,
Anything
Don.
else? You bet.
Thanks. Anybody else have a question for Mr. Knapp?
Perfect.
All right, thank you. Oh, Cory, are you saying bye or you have a question,
No,
Cory?
I have a question. I have a question. So, hi, Don. Thank
Cory.
you for the information. So I just want to be clear. It sounds like through the enforcement piece, it would be at least 48 hours, 24 hours while we were gathering evidence before we could actually close something down. Is that accurate? Like
No,
if,
so the process is after an attempt for voluntary compliance, unless we can show that attempting voluntary compliance is fruitless or would put lives in danger, the health department has the authority to padlock a building under the Illinois Department of Public Health Act. Upon taking that action, we have to serve the individual or the business owner with a 24-hour notice. That 24-hour notice has a number of requirements, one of which is that the owner or individual can appeal the decision to padlock their business under the Illinois Administrative Review Code. And that's where I go to. There's been a lot said about due process, and we of course take that incredibly seriously. If we follow the dictates of the Illinois Department of Public Health Act, there simply is no due process argument that could get us in trouble. We're putting, due process at its core is notice and an opportunity to be heard. If we attempt to take voluntary or seek voluntary compliance, that's notice. If we serve people notice that you have a right to go to under the Administrative Review Act, go to court, that's the opportunity to be heard. So could we shut something down for 48 hours before we go into a court? Absolutely. And then it's up to a court to decide. And that's a good thing. That's a good thing. Okay.
Thank you so much for that clarification. That was my concern, is that if there was something that really did appear to be putting the public in danger, could we act swiftly? And obviously we can. So thank you very much. And then I have one other question, and that is, if you had someone who was in an establishment refusing to wear a mask, and it was believed that that was that was an endangering kind of thing, and after that person had been asked nicely to wear the mask or a mask had been provided or whatever, obviously there's no way that can be policed in every establishment throughout the county. So is there any thought about how that should be handled? And that's probably being handled right now in some ways, but just your thoughts on that.
So one of the things I hesitate to get into tonight but like I say, Ms. McKnight, Ms. Rodriguez, and Chairman McIntyre, Mr. Anderson, we've spent a number of times working through our scenarios like that. And ultimately, and one of the reasons when Sheriff Sandage and I came out with our press release about the criminal side of things, we put our phone numbers, because we invite the public to call me. I can't tell you the number of calls I've had, and to work through these scenarios with individual lawyers. I've heard from pastors from Hayworth to businessmen to Lexington and everywhere in between. And we work through the scenario so they can make an informed decision on whether they want to open or whether they don't want to open, or whether they want to be outside with a mask or not. So I'm not trying to duck your question, Ms. Tello, but ultimately, what my office believes is there's going to be case-by-case review of everything. If Tom Anderson wants to risk his health to go out because he gets a complaint at Bob Knapp's Brantville, I'm going to review the report, and I'm gonna see if it meets the standards of the Illinois Department of Public Health Act. So I suspect in the specific situation you're describing, we would seek, as we have been seeking, voluntary compliance and education. But barring that, there are a million different factors. Do we have any knowledge that the person is COVID positive, has been exposed to COVID? Has anybody in the establishment been exposed to COVID? And those are the misoginations by the thousands that we would go through in that situation. So Dr. Ginsburg.
Yeah, Dr. Ginsburg. Go ahead.
As I've been reading through these plans, one of the themes of all of the plans, both the Restore Illinois plan and the Heart of Illinois plan, is social distancing and masking in every phase. Now, one of the big differences between the two plans is that there are certain businesses that are addressed opening earlier in the Heart of Illinois plan, which is why those businesses are really very supportive of the Heart of Illinois plan. My question is, what if you have a situation where the business in and of itself makes it impossible to follow social distancing and masking? And specifically, I'm kind of thinking about bars.
Mm-hmm.
How do you social distance and mask in a bar?
Well, one of the requirements, and this is some things that Ms. McKnight and I have talked about, one of the requirements by the time I get to filing a petition with the court is I have to prove that the order we seek and the relief we seek is the least restrictive method available to stop the spread of the disease, right? And so I have been very poignant to ask, who is going to testify from the health department, or what expert are you going to testify? Give me to say that the least restrictive means we can take to stop the spread of the disease is to close this business. And what's their answer going to be to the business's lawyer who says that why can 300 people be at Menards or Lowe's or wherever? So the answer to your question, Dr. Ginsburg, is I absolutely go back to the language of the Illinois Department of Public Health Act and the administrative code, and I just go through those. I go through the elements there. And can I envision a scenario where we can meet all those elements? I can. Can I envision a scenario where we cannot meet all those elements? And in which case, I'm not going to risk my law license to file an unfounded pleading with the court. And that's why when I get calls like that, and it's probably beyond the scope of a meeting like this, but when I get calls from business owners, I walk through a million different scenarios so they can make an informed decision. And in the bar scenario, one of the things I always tell them too is don't forget Ms. McKnight and the state's attorney's office are not the only enforcement game in town. Rumor has it the Attorney General and the Illinois Department of Public Health are known to swing a big stick, and they can enforce any laws that I can enforce, and they may be more reticent, or they may be more apt to come in and take enforcement action where I'm going to follow the strict dictates of the Illinois Department of Public Health Act. So that's probably a lawyerly non-answer, Doc, but that's the best I've got.
Dr. Janetti, do you have a question?
Actually, I do. Can you hear me okay?
Yes, sir.
So first of all, I'd like to thank everyone for attending tonight. It's really encouraging to get all this attendance and everyone's appreciation for this issue. So, we received a bunch of emails and, people have been talking about this. And of course, we all come at this with our own potential biases. I mean, whether you identify them or not, because just your experience with what's going on. So this afternoon, I went to the CDC and looked up CDC activities and initiatives supporting the COVID-19 response and the president's plan for Open Up America Again. It's from May of 2020. So I was trying to get some independent look at, what the CDC said. The recommendation just came out. So it's about a 60-page document, but on page 6, it talks about phase plan and indicates to reopen America. I just want to read to you a couple lines and then ask for some response. So the plan to reopen America outlines a 3-phase approach for reducing community mitigation measures while protecting vulnerable populations. This phased approach can be implemented statewide or in a community by community at the governor's discretion. So it's community by community at the governor's discretion, not necessarily at local governmental agency discretion. So that's the CDC recommendation. So if we have something like that out there, where does that put this board or the McLean County board in making recommendations that would potentially go against the CDC? I mean, just asking a question.
Well, again, I go back to the Illinois Department of Public Health Act in any enforcement action I'm going to take, and where the CDC plays into that determination is there are satisfying CDC guidelines can be a method of determining what is a dangerously infectious and contagious disease. And so, yeah, there's some, and I'm not up to speed on all of the federal authority, but if I get your question, there is a federal guideline from the CDC that says the governor shall issue some type of plan and can give local authorities or local units of government the ability to deviate from that if they so chooses. But I'm unaware of anything in those CDC guidelines or federal law that would just invalidate the Illinois Department of Public Health Act. And so some may say, and I know a legitimate question is, given what you're saying, Don, what does it matter? What does it matter if a plan's endorsed, whether it's Restore Illinois or Heart of Illinois or the CDC plan? And my response to that is, to the constituents I talk to, it matters a hell of a lot that people are looking for as much information as they can get to determine whether they want to open their business or whether they don't want to open their business. And so having that, Dr. Giannetti, having that bit of information is a piece of information for them, but it's just a piece of information. And that would be my response.
Thank you.
You bet.
Susan, hang on, Susan. You thought we're gonna get away that easy.
One of the things you kept saying, it was something about infectious or communicable disease. You used a term with 2 words in between. I can't remember what they are now.
Dangerous
What does that?
communicable disease, right?
Yeah. What does that? Do they have definitions of that in anywhere, or what does that mean, and how does that actually apply to COVID?
I mean, for most of this to apply, there has to be a dangerously contagious or infectious disease. And that is defined in the Illinois Administrative Code as an illness due to a specific infectious agent or its toxic products that arises through transmission of that agent or its products from an infected person, animal, or inanimate reservoir to a susceptible host, either directly or indirectly through an intermediate plant or animal host, a vector of the inanimate environment. And this is the important part of that definition, that again, if I get asked to shut someplace down, I'm going to ask for who's going to testify to this by the health department, and may pose an imminent and significant threat to the public health, resulting in severe morbidity or high mortality. So I'm going to need to know exactly what the morbidity is, exactly what the mortality is, how we define that, how is it better or worse than anything else that's in the public, and who's going to testify to that if I have to go to court. And so those are the conversations that we're having. And I think we have a good idea, and I'm no public health expert. We have a good idea how many people in the community have died from COVID or were COVID positive that died. But what's the denominator, right? Dr. Ginsburg, can you tell me what the morbidity or the mortality of this disease is?
No.
Because those are answers I'm going to need. And looking into the history of the public health code, since 1922, the Illinois Supreme Court has acknowledged that the Illinois Department of Public Health, and by extension, local health departments, are the supreme authority in infectious diseases. And in that 1922 case, which is a case out of Chicago, there's discussion of the act at the time. And I don't know for a fact as I stand here, but there's discussion that I think the process 100 years ago was the Illinois Department of Public Health simply had a list of these are contagious and infectious diseases. I think that has been supplanted because they acknowledge in that case the Spanish flu was not on that list, but of course it was highly contagious and infectious. So I think what happened was the act evolved to include that definition. Now I'm less concerned whether the act evolved, and I'm more concerned of how do I meet that definition if I have to go to court and say you have to close down Bob Knapp's Brantville because of a highly contagious and infectious disease. And those are the conversations I've been having with the health department. Again, can we meet it? Potentially. Can we not meet it? Potentially. It's going to be case by case, but that's an important piece of this. And we've talked about extrapolation. We can maybe by extrapolation decide what the morbidity and mortality rate is, but those may be guesses. Would those be good enough for a judge? Depends on the judge. We'd have to figure that out. So I want to be incredibly clear that that we would look to enforce this act if asked by the Board of Health and the Health Department. Hannah?
Took me a second to find the unmute. Kind of taking you back to enforcement, Don, and maybe on a different tack. I understand what you're saying, and I think there've been a few times when the health department has had to try to enforce quarantines and tuberculosis cases, and it is difficult. But the HOI plan sort of sets some staggered openings at certain occupancy rates.
Okay.
Fire code, and I guess the question I have, and maybe you can answer it, or it may go to more local jurisdictions, but I'm going to assume that those limitations then factor into our, for example, food permits. So a restaurant with a food permit cannot exceed that 50%, say, in step one, or a bar or whatever. And that, there may be some enforcement taken if they're exceeding those capacity limits. So it'd be a different approach to enforcement rather than the closure or looking at the disease. But, if the county is saying either the limits until we tell you they go up. And I don't know if your office would necessarily be involved or whether it'd be a matter of local law enforcement. I think the fire department would certainly be an entity that might come in and say I guess, let me back up first is, what is your opinion about how binding those occupancy loads are on businesses going forward, since their fire code limits are higher?
Yeah, I think that maybe, first of all, Hannah, I haven't really researched that. I've spent my time doing maybe a different level of analysis, focusing on, I haven't studied the Restore Illinois plan. I haven't studied the HOI plan by any means. My review of them was mainly for the purpose to see what law they cited in a preamble or within the act for what law they were seeking to enforce. And then had I read them, yeah, but I did pay attention to those metrics. That may be a great question for Tom Anderson, because we already, regardless of whether the occupancy is 50% of what it was, that's something we do day in and day out, I believe, is enforce those laws. And when I say we, units of government, whether it's Mr. Anderson's division or whether it's a fire department, I'm not 100% sure, but I can certainly look at that and get back to you. I just haven't spent a lot of time doing that.
Yeah, I appreciate that. And I do think that it might end up at your office if it's a county food license and they're exceeding occupancy. I don't know off the top of my head, but it might be an easier route to go if we are faced with some people flouting. I mean, clearly a plan is great as long as it's implemented properly. And if there's, as you said, tremendous difficulties in enforcing it through the IDPH approach, I think most people are honorable and they will follow it, but we will have cases where it's not. And I think we need to explore all options for enforcement, because otherwise the plan fails.
And the great thing about enforcing an occupancy level or the permits, be it a liquor license or a food permit, is we do that every day, right? There is a process in place to do that every day. And the holders of those permits have their due process rights spelled out, and they know how to contest any enforcement action because we do it all the time. So I haven't really studied that, the specific portion of the occupancy mechanism or trigger, but I can get back to you. Are we done? Thanks, everybody.
Yeah, that's pretty easy.
I think it did.
Don't go too far.
Don't go home just yet.
Well, we have Ms. Woods on our screen also, so she can, help us out if we don't get into trouble. The next thing I want to do is just go on page 3 of the combined where we have a side-by-side comparison. I just want to kind of go through the metrics because, again, my concern right now, my overriding concern is capacity. Because our health department, and this is not a negative thing with the health department, I'm not putting anybody down, but we're asking them to really step up and do a lot of extra duties in addition to what they were already doing. And I'm just concerned about that. I just want to be sure that we have capacity to do that, because I've heard through the news that we can ask for assistance. Now, whether we'll get it or not is another thing, but we can always ask, okay? So just for, just as to get us started on the Restore Illinois plan, there is the ability to test 10,000 tests per day statewide. What that means for us is 138 people a day. And if we keep the
Community-based testing.
yeah, the testing site that we already have, then we should be okay, so long as we keep up our advertising and encouragement. We want to encourage folks to get out there. Obviously, if we can do something where we're bringing the testing more towards town, I think we all recognize that it's a great site, it's convenient, it's safe because it's drive up, so you have least amount of spread, and it's safe for the people who are giving the tests, but it's not a convenient place for most of our, our population. And I did get a little geeky with numbers, and I'll apologize to you guys in advance, but 27% of our positive cases are African Americans. And I just don't think that the McLean County site is a good place to be, but that's something that we can work on. So testing wise, we should be able to meet that metric. So then if we move to and you guys stop me anytime. That's another thing to choose up. The Heart of Illinois plan, so this is a Peoria plan. So we would need to be able to track ICU bed capacity, the total number of ventilators that were in use, total number of admissions from the 2 hospitals in the area, as well as what we're already tracking is positivity rate, the percent of COVID-19 cases within 16 hours. We can do that. And we did have a nice graph on the website where we have a little graph that shows how we're doing. Because remember, raw numbers mean nothing. It's how we're doing over time. Dr. Ginsburg?
Yeah, one question is in the Heart of Illinois plan, since it's a regional plan, it's not a single county plan. Are we looking at our ability as a county, or are we looking at our ability as a region? Because, if you look at the region and what it's made up of, you're talking, there's two relatively major cities in the region, Peoria and Bloomington Normal. There are, I believe, 5 hospitals that are capable of critical care, and they each have to report. I was actually at a critical care meeting this morning, and I was told that they have to report twice a day to the state how many ventilators are in use, how many beds are in use. But there is also quite a bit of variability, or a little, there's kind of each of the hospitals has its own surge plan. And I know I can't speak for any of the other hospitals other than Broman, but the surge plan may involve using other beds within the hospital as ICU beds. We have not come anywhere close to this so far, but there's a certain critical mass when you get to a certain number of COVID ventilator patients in your ICU that you want to basically isolate your ICU from everybody else and turn it into a COVID unit, and then put your other critical care, your non-COVID critical care patients in other places. And we have the capacity to do that at Broman, and I know that St. Joe's has the same capacity to do that because there are these beds that are kind of swing beds. And so it gets a little more, when you're looking at some of these numbers in that metric, it gets a little dicier, because I asked them this morning, how many ICU beds, what does our state license say as far as ICU bed capacity? And I was told 12 beds. But there are actually probably more than 12 beds. And if you've looked at the hospitals who are overrun in New York, they were using ER, they were using the recovery areas, they were using all kinds of places which would never have been ICU beds as ICU beds. So you have to take a lot of, take some of this stuff with a bit of a grain of salt, because the hospitals do have ways to manipulate things not according necessarily to what they're licensed for by the state.
Right. Thanks. You want to talk about the dashboard? Okay. no.
I know that there were questions about the dashboard and all of the data, and really a place for the community to put complaints, for us to make guidance available. And Peoria, their community engagement group, I believe, they have put together a website that we are able to opt into for no cost to us that does make those things available. So a place where businesses can go get information about what guidance they would need to reopen, and be able to certify themselves, showing the public that they're meeting that guidance, and even showing us that they're willing to comply with that, and also a place for the community to submit complaints. So that has been, one of the capacity issues that we are looking ahead at is fielding complaints and responding to that, also providing guidance. We've been kind of a hub for people to receive guidance and education about how to develop their plans and review their plans. And so this gives us the ability to potentially provide information to our community partners a little quicker than maybe we're able to respond, because that guidance is at their fingertips. Did you want me to talk a little bit about the data?
Sure.
So, the data in the HOI plan is looking at ICU beds in use and hospital beds in use, vents in use, and those things for also COVID. So we do have the ability to pull that from a resource where the hospitals are inputting that data 2 times a day. And so I have that data just for the last couple of days. And then obviously for the Restore Illinois, we've got the data that IDPH has put together for the entire region. So, we do have access to data, and it's something that I'm continuing to work on, is getting us more access, because positivity rate is something that we currently do not have yet, but hopefully I've got access to some programs that will be able to sort through our tests. That's been one of our issues, is we get test results for the PCR, that diagnostic, and antibodies all mixed in together. And when we look at positivity rate, we don't want to count those antibody tests in with that. So it's going to be some reports that we can run from that data to get that information for us.
So, okay, go ahead, Sonia. Sonia first. Sonia.
Yeah. I was just going to add, as we're talking about what we can and can't do, the state has been incredibly flexible about what hospitals are needing to do. I'm working with the advocate hospitals in the Chicago area, and their situation is so grave, and they're adding beds anywhere they can, in taking ORs and putting beds in them, and recovered rooms, putting beds in them, and they're closing some services. We closed OB at one hospital just to have room for more med surge. And the state has simply said, let us know what you're doing and go ahead and do what you need to. So I think any fear about how many beds we have and don't have is not a solid fear. As long as we can actually find a place for a bed, I think the state is going to be very open to that.
So just to be clear, I'm not concerned about whether the community has capacity. I'm worried about whether we have the capacity to provide that information. We mean the health department. So someone's going to have to take all that data from 4 or 5 different sources that is not easily teased out, and then enter it into a dashboard. And that's something that's an additional duty that no one is doing, now. I mean, not to this detail. And so that's kind of my question, is do we need to hire somebody to do that?
Well, and with our funding that we're getting from IDPH for contact tracing, was something we were discussing today, is that a potential for, epidemiology, bringing on somebody, whether it be interns or recent grads, somebody to help with this data management. Is this our chance with that extra funding to do that?
Yes, Hannah?
And I'm kind of following with Dr. Ginsburg's question. I just want to be clear. I had thought I heard on the news that Peoria had not proceeded with this at this point. And I guess what I want to know is, are we looking at numbers across this 11 county area that's within the plan? Is that what we're looking at tonight? Or are we looking at this as something McLean County would use as a model just for McLean County?
So I have the data in front of me just for McLean County, and then obviously the larger North Central region that is in the Restore Illinois plans. So, finding the data, it's what metrics are we wanting to look at?
Well, and I guess I asked that because there are metrics within that HOI plan, which could look very different if we only look at ourselves or if we have 11 counties contributing. So to be clear, when you said, are we getting data? Are we set up to get data? Are we planning to implement this as an 11 county venture? Or are we looking at this as just a McLean County venture?
That is an excellent question. Doctor, I don't have an answer for that. That is something that we need to explore. It seems like might be easier in some ways to track the data, because if we have someone who is in Tazewell or Woodford County, they may or may not, because then they're kind of that in-between area. They may probably, okay, I have nothing to base this on, just so you know, but other than talking with people in the OB unit, they may come here or they may go to Peoria, but they would still impact we'd still have to count them, and not count them, we still have to account for them in terms of our hospitalization usage.
This Dr. Janetti. So we look at this number across our ministry every day, and we've never really been in any issue with ICU beds or ventilator capacity throughout our hospitals in the ministry. And we have multiple locations, in this region. Now, with that said, we're also now going to start doing more elective cases, which will tie up some of those beds, right? So that'll get a little tighter as we open up other business avenues. But I think the capacity in the hospital systems and our system is there. And I don't have inside an advocate, but when I've called Carl a couple times, how you guys doing? They would tell me, well, we got 9 in or whatever. So I don't think the hospitals regionally have been stretched at all because of this.
Right. No, we've been incredibly fortunate, I think, in that, because of our lack of density, and I'm guessing just from what I've been reading in different articles, because we don't have a lot of international travel into the area. It's not like Chicago where you have an airport that attracts, international travel. So that, and the fact that we're not very densely populated, and don't anybody take this offensively, especially since it's my employer. This struck when the ISU wasn't in session, that we were in session, but the students weren't on campus. So that, I think those 3 or 4 things probably have helped us out a lot. Do you, Dr. Ginsburg and Sonia and Dr. Janetti, do you guys know, are the hospitals coordinating between themselves? Again, when we're doing planning, you don't plan for the good time, you plan for the worst case scenarios. That's why I'm doing this.
I don't know that within town, for example, that OSF and Broman have coordinated their surge plans, because this really comes down to surge planning, planning for the worst. And I think each hospital is going to have their own surge plan based on what their capacities are. Staffing has to be taken into account. There's a lot of things that get taken into account for that. The other thing is that the region, we're kind of, in both plans, in both the governor's plan and the Heart of Illinois plan, McLean County is actually kind of on the fringe of the region. We're physically located on the fringe of the region. But we have Broman and St. Joe's and the Peoria hospitals have a catchment area. Because if you look at Woodford County, for example, Woodford County has one hospital that has no critical care capacity. And so, you know, if you just looked at Woodford County on this, they would never have any critical care beds because they ship everything out. We get a good proportion of the patients from Eureka Hospital because they're within our system. But we also get patients from hospitals that are not even technically in either of these regions. We get them from Gibson City and Ford County. We get them from Clinton and DeWitt County. We get them from Abraham Lincoln in Logan County. So at the moment, we're kind of a catchment area for all the surrounding counties, and that affects our numbers. Now, one thing I did hear in this meeting that I was at this morning, and I think this came out recently, because the hospitals are very financially motivated also to get their elective surgeries going. And I believe what I got this morning was that there is a new rule, I think it's a state rule, possibly IDPH, that basically says you have to have 20% of your ICU beds have to be open in order to do any elective surgeries. And this can become a big problem because intensive care units, even not in a pandemic, you know, forget coronavirus right now, but hospital ICUs have a tendency to roller coaster. You know, they can go anywhere from 0 patients to 12 patients in 2 days. And a lot of those patients are coming from outside hospitals. Well, now you've given hospitals, this rule has given the hospitals a financial incentive to keep their ICU beds or to keep a certain number of ICU beds open, to the point where we may not accept transfers from other hospitals if we don't have enough ICU beds to keep elective surgeries going.
Interesting. Hannah?
And I guess I would like to have some guidance for how we discuss this further tonight, or whether because as we look at, you know, the plan relies on collecting data and evaluating where we stand on these metrics and moving forward. I think we should decide, maybe from our discussion, are we talking about something where we would limit those metrics to McLean County? And I realize the hospitals draw from regional areas, and so that's a little different, but in terms of percent, you know, positivity, those other measures. And I think we need to decide that, because I think one of the questions I was going to ask later is, where do we look right now on the scale? If we were to determine today whether we were ready to move from 1 to 2 or into 1, where do we look? And so I'm assuming we don't today have that data.
That's correct. Right?
Yeah, we have obviously the data that would show us that we could move to phase 3 of Restore Illinois. But it is difficult to compare. You know, we've got that chart that compares the HOI plan, Heart of Illinois plan, stages, phases to the Restore Illinois plan, but that's assuming that you started in the same place, I guess. And this wouldn't necessarily be starting in the same place, because we're looking at where we are right now with Restore Illinois, and when did we start with HOI plan? So yeah. But yeah, I mean, according to the Restore Illinois plan, the metrics we've met for the last 2 weeks to move into that phase 3. And, you know, when we're looking at our ICU beds in use, vents in use, and the percentage for COVID, according to the HOI plan, those are within the metrics. But again, this is incomplete data. I don't have all of the metrics to say that, but this is again also telling us how we could move from phase 1 to phase 2 in the Heart of Illinois. It doesn't tell us, like Hannah said, but I guess phase 1 for Heart of Illinois is just where we are.
Right. That was my understanding.
I have a question, Carla. This is
Yes.
Judy.
That's
And
Sorry,
I'll just yell out.
that's good.
Uh,
Now it
Jessica,
works.
Jessica, you've just started, I think, articulating one of the questions I have, or one of the issues I hope we can discuss. And that is, as you look down at the comparing Restore Illinois and the Heart of Illinois, are there, and you're mentioning some specific expectations in the Heart of Illinois plan that we either don't know what the time frame is, or even given the time frame, we may not have the resources or the capacity or the capability to do that. So is there a way that we can have you help us understand what in that plan makes good public health sense, as well as what in that plan are we in a position to do, even with some additional dollars from IDPH?
So I think the metrics in both plans make good public health sense. It's kind of that what Hannah had posed, where that in the Heart of Illinois, what we have is what could get us from phase 1 to phase 2. And so we're just assuming that we're already at phase 1. So like, I don't know if there are determinants on how bad things would be to where you are in phase 1. We know how to get from phase 1 to phase 2. But in terms of the metrics, those two plans both have good public health metrics. There are a few, again, that we're working on getting the access to the data for. Hope that answered the question.
And I, as I looked at it, it certainly does. Thank you. Partially, as I read the Restore Illinois plan from the HOI, it speaks to individual departments being responsible for a number of activities. It's my understanding that we were not engaged in the drafting of this plan. Is that correct?
Not engaged in the drafting, but we are involved in the continued communication and potential for edits.
Mm-hmm. And so where might there be some hoops that we may find it difficult to jump through in terms of the responsibilities that are listed beginning on page 10?
Of the plan here.
Of the Restore Illinois plan, yes. Not the comparison, the actual plan.
So this is similar to that dashboard that the website that I'm talking about.
Right. Mm-hmm.
It checks a lot of these boxes for us. But these were my big, how are we going to meet this with the current capacity that we have? But the website that has been created would definitely create a centralized digital hub of information. And my question that I posed to Peoria County is, will the metrics data also be there? Because it sounds like that is something that we also want to be able to make visible. We have our limited dashboard available right now with the data that we've been collecting, our case counts, the demographics, and et cetera. But it sounds like we're wanting to also make the rest of these metrics that determine what phase we're in public. And so that's been my question. So I had that marked as, partially complete, but creating a virtual plan review process. Again, on this website that Peoria has created, there is the ability to make that guidance available and allow businesses to know exactly what they would need to be in compliance and be able to, check off those boxes and have those things in place. And, that is, again, one area where we've been kind of struggling with capacity of being able to review all plans submitted to us. It's a lot. And so this would potentially free up a little bit of our capacity, having this on a website. And then same thing with the self-certified compliance worksheet. That is also part of that website, that part of that process where the businesses would go on and complete that. This is the guidance that's available, and I'm checking saying that I can comply with that. And then same thing with the create a reporting mechanism where residents can voice concerns. Again, this website has the ability to offer us that. So these were definitely areas of concern for me of how would we as a health department meet this. And I feel a lot more confident now seeing this website and the capabilities that it has.
Susan.
I have two things. One, I know what go back to what Hannah said about nobody else has really kind of approved this. I mean, you have the Peoria County who apparently is driving this whole thing, yet, and their public health department came out with, in that press thing last week or 2 weeks ago, whenever it was the Peoria mayor and the county board chair, yet none of those entities have taken really any action on that, whether it's their Peoria's Board of Health or, any of these other counties' boards of health or their county boards. And can you, in your discussions that you may have had with those other county health department administrators, can you give us any kind of indication as to why that hasn't happened? If this has been going on for, they created this plan with all these other counties and yet didn't really kind of ask for input from all of these other counties, yet they're not even, voting on something on their county board level or the city level. And yet they said that they were going to implement it within 7 to 10 days. So can you give us maybe some insight as to how this process actually started and what and how their direction is? I mean, are we going to be the lone wolf out there that approves this? If we want to do that and say, yeah, go ahead, county board. And then, so that's where I'm kind of, where are they coming from on this? Or is this just an exercise?
Yeah, those are good questions, and a lot of questions I don't have answers to, unfortunately. I know that it originated, Peoria County had developed it solely for Peoria County, and then was looking at, commuter data, hospitals, and just more regional. And they were actually in the works with this plan before the Restore Illinois plan came out. So that kind of also threw them for a little bit of a loop, because then the governor had a larger region. And so then it kind of made more sense again when they were looking at commuter data and the hospitals to break us up into sub-regions. I do not know what the other counties are their plans for moving forward are in terms of voting to go with different plans. I do not know that.
It's Dr. Janetti. I have one observation here. It's almost like I'm pretty comfortable with the state moving to phase 3 in Restore Illinois. It almost looks like the Heart of Illinois plan kind of starts this in the middle of phase 4. Am I looking this incorrectly? Which almost like jumps through 3 before you even give it a chance to see how it works.
No, I believe that's pretty accurate.
Mhm.
Dr. Ginsburg, did you want to?
Yeah, I think from all of the reading that I did was they created this plan and then just presented it to the governor to see if the governor would go along with it. And essentially the governor said, no, everything just stands the way his plan is. So I don't think that any of the governmental bodies in Peoria County or any of the other counties have acted on the plan, mainly because they were just waiting to hear from the governor.
And Carla, this is Judy. One of the things, as I recall, when the Peoria folks introduced their plan to the media, they said that they were going to go ahead regardless of what the governor's response was, and that they were also going to submit it to the Illinois Department of Public Health. And it sounds like we don't have any information as to whether or not they're actually even going to move, or has public health responded to them in any way. Seems like there's a vacuum out there.
Thank you, Judy. Susan, go ahead.
Yeah, there's a follow-up question on that, because Jessica, you also said that they were looking at tweaking it or changing it or whatever. And excuse me, is that based on other counties? What we say, and then what I don't even know all the counties in there. Stark County, I think, might be in there. They might say, because some of those, like Dr. Ginsburg said, that their hospitals can't handle these kinds of things, and maybe their health departments don't have the capacity to do some of the things that are in this plan. So if they're tweaking this plan, then when is there really a plan? Like that you would say, like the governor has a plan. I'm just, because he finally put one out. He is tweaking it along the way. Obviously, he's done that now. But when is this a final plan to go forward when they say they're going to do it within they're going to, regardless of what the governor says, these other counties are going to go forward, I guess. So that's in some of your conversation.
Yeah, and my question had been, and unfortunately I don't have an answer yet, of is it an all or nothing plan where all 11 of the counties in the sub-region do we all have to be on board for it to move forward? Or if, 4 or 5 of the counties in the sub-region decide that they're going to go move forward with this plan, are they able to adopt it? But I mean, that kind of gets into some of that legal of, do you legally adopt a plan? And what happens when you say you're going to follow a plan? What are you bound to, I guess?
Right. Ms. Wiz, do you have any input on that? Or not?
Hi, unfortunately, that's a good question of, I don't know what our liability is or what it is not if we go forward with this plan. And then are we liable for anything or nothing? I mean, I don't have any good answers on that for right now. I don't know if Mr. Knapp already left or if he has any answers. But it's something I could.
I'm sorry, I thought you come back in.
And yeah, I guess if there's a Heart of Illinois plan and it includes 11 counties, but then one county uses
Right.
these metrics, what does that mean?
Right. Thank you, Ms. Woods.
My thoughts are, and we've gotten questions about liability. What's our liability if we don't strictly enforce the governor's plan? And we can get sued at any time for anything. And my answer would be, it's probably no more or less than if action is taken, and let's say the mortality and morbidity rate comes back incredibly low, and in 2 years we find out this doesn't meet that definition of contagious and dangerously contagious and infectious disease. Or let's say that a court, the Supreme Court or the U.S. Supreme Court, find that the Restore Illinois plan is unconstitutional. Then we've taken action under color of authority to violate somebody's civil rights. So there's statutory immunity in both the Illinois Emergency Management Agency Act and the Code of Civil Procedure that applies to us. So what our liability is depends on the actions we take, and that's where I go back to. I am relatively positive that if we strictly enforce the Illinois Department of Public Health Act, we satisfy all of our obligations, and we have incredibly limited liability. So to answer the question, I don't know I didn't study the particulars of the Heart of Illinois plan or the Restore Illinois plan. So I'll have to defer to Ms. McKnight of whether we can go it alone, whether it's data from an individual region, and even without those metrics, I think the value of your discussion with the Board of Health and the County Board is signaling when you would seek to take enforcement action for the general public and what that action would look like. So that's my thoughts.
And I just want to, I think, and Tom, you're going to correct me if I'm wrong, but we don't jump straight from a complaint to lockup. We use a process of education and attempting to do voluntary compliance and problem solving, because that's what you've mentioned in the past. Is that correct?
That is correct.
So
It's very good. There's a lot of steps that we would have to take before we went to Jessica or Don and asked to lock up a business or pull their permit.
And the same thing with an individual, because I think in my experience, we've used the Public Health Act more frequently with individuals who are not adherent to their therapy, particularly in TB, mostly in TB. Hannah, did you have your hand? Okay, go ahead.
Thanks. I just wanted to maybe direct this to Ms. Schaefer so that I understood. So the county board has an action item on May 28th to approve this. Is it the plan, and we're talking about this was the multi-county regional plan, but none of the others have done it. So is it your understanding that if the county board is to approve that the expectation would be that we would begin operating under this plan in McLean County, regardless of what other counties have done? Is that where we're going with the county board action? Do you know?
I'm not sure that the answer to that. I think depending, I mean, it's going to come for an action item to approve a plan, to have a resolution. Now, the resolution can be the plan. It could be another plan that we don't know about yet. It could be a letter of support, which is what I think some of the jurisdictions, the cities have done, other local, smaller cities. I think that the city and the town both sent those in to the governor to saying that they support that plan. If I remember hearing that correctly, don't quote me on that because I'm not quite sure on that. But so it could be any number of things depending upon, you've been there, you know how something is going to come to a vote. What exactly? Really not sure yet, because it could be changed at any time. It could be amended. It could be a lot of different things. So I think that the expectation is that some plan is going to be voted on, but I can't guarantee that at the moment. Does
So
that answer your question?
this is probably my fault because we haven't gotten around to drafting a resolution for a county board packet yet. But that's probably my weekend assignment, that I believe the letters of support, that by statute have to describe the nature of the business to be considered at the special county board meeting, were worded in such a way that the resolution will have to say, resolution to implement the immediate effectiveness of the HOI plan. And so, as Susan said, is that what gets passed? Does that get changed? You know as well as anybody how that comes about. But that is what I intend to draft based on those letters. I just haven't gotten around to it yet.
I'm sure you have nothing else you're doing, but so for our purposes of discussion tonight, then yes, things can change drastically, but at this point it would be, we're looking at something that ultimately would lead to the county board wanting to implement this plan immediately in McLean County.
Right, and so hang on just a second, Sonia. And from a public health perspective, are the plans, the way they're written, because I'm sure that they'll change, but the way the two plans are written, do those meet public health safety and standards? So is there enough data in there that that we can move forward if things continue to go the way they are? Is there enough of a brake system in there I realize that you guys must think that I'm the, glass completely empty, but when you're doing planning, if we had a huge outbreak and it started to overwhelm our hospital systems, like what's going on in Montgomery, Alabama, do we have a way to go back and forth, and do we have places along the way where we can look at data and say, we're good, we've got a green light, we're just like what's in the HOI plan. We've got a green light, everything looks good, we should be okay. Uh-oh, it's starting to turn red. Do we need to do something else? Sonia's first.
Well, I was curious about whether this 11 county area all has to approve this plan to make it effective. 11 counties, a number of them are smaller, don't have hospitals.
Right.
I'd be curious about that. And, you know, whoever knows, if Don knows or somebody knows, what's the implication if Peoria and McLean move ahead and the others don't?
Anybody answer that? Yeah, I don't know either.
That's my question.
This is Judy, and are you, Sonia, are you done?
Yeah, hang on. Oh, yeah.
I'm waiting for Don to answer.
Right, here he is.
Hi, Sonia. If it's the Board of Health and the county board's prerogative, they could, and again, what these plans do is signify to our citizens what enforcement action units of government will take, and they can, they can easily vote to use the metrics in the HOI plan as they pertain to Peoria or to McLean County. They can easily do that. Now, are there going to be repercussions with the state? Sure. But there's nothing to be said that you can only implement the plan or let me rephrase it. You can only choose to use your discretion to take enforcement action if all 11 counties do the same thing. Does that
Okay.
clarify anything?
So some freedom on that. It's the guidelines, and the guidelines are kind of shaped around the 11 counties. But
Yes.
we would be free to operate if not all 11 actually approve them.
Sure.
And just to be clear, the county board would be free to operate. Judy?
It's a clarification. I'm sorry, I missed a piece of, it sounded as if there was reference to municipalities having written letters of support. Was that something that was reported that has been done? And was it our municipalities? Because it's my understanding that I would be surprised at that. So I'm curious.
I don't have, I mean, I heard that through things, actually on that one call, Mayor Renner was supportive of the whole thing. And so,
Mhm.
and so, and I know the chairman has talked to some of the mayors of other municipalities in the county, smaller municipalities. And I do believe some of them have done that. That's kind of the impression that I got from him. I couldn't tell you which ones, because he didn't share that information with me. And like I said, I'm not sure as to what Mayor Coos did. I've heard both ways on that one. So
I've been in communication with both municipalities, and it would appear that while they, and I'm not quoting them, but what I took away was that they thought there was some benefit to the HOI plan, but we're really concerned about deviating from the governor's plan at this time.
Oh,
Okay,
I came
so-
to the podium, it's Camille, and I'll just concur. I think that when the Heart of Illinois plan was first introduced to many of the elected leaders, there had been an initial support through a letter of support that did not mean that it was going to be adopted. And I think that it only meant in those moments that those elected officials were, understanding that Peoria County and city were going to send that on to the governor's office and on to public health. From that point, you've all reiterated the same. It seems that, all of those elected, well, not all of those elected officials, but many have said, well, we didn't mean that we were going to adopt it. We are considering, but nothing has been formalized. It's to our knowledge, no votes have been taken. So I hope I didn't confuse the issue, but definitely what you've all said seems to be the case. It's just been a consideration. So I hope that's helpful.
Dr. Ginsburg.
Well, looking at the plans as they currently stand, I mean, you can split hairs about the metrics. One that I think the metrics in the Heart of Illinois plan can get a little too detailed, but at the same time, and the metrics in the governor's plan are not quite as detailed. But I think that's mostly splitting hairs. The huge difference between the two plans is how aggressive they are at opening the businesses. And as I said before, both plans specifically state all through their plans that they rely on masking and social distancing almost all the way through the plans. But the Heart of Illinois plan clearly is the favorite of business owners because it's opening businesses earlier than the governor's plan. And most especially restaurants and bars, but I think it applies to other things too. And that's where, you know, I've gotten emails from, and I think we've all gotten emails from restaurant owners and such leading up to this meeting. Personally, I go back to my example in the bars before. I don't know how you open a bar and social distance. And I have this nightmarish scenario in my head of what happened in Wisconsin when the Supreme Court struck down their closing laws, and the bars opened up, and they turned into, you know, a big party. And so we're trying to prevent that, because that is probably going to be more responsible for the spread of this disease than anything else. And, you know, I agree that the governor's, you know, I've had to try to explain to people about 2 people in a boat and other parts of the governor's plan. But the restaurant, I mean, if you open up, even at 50% capacity, if you open up the restaurants and bars, you're inviting people to take their masks off. You're inviting families who are not related to spend time in close quarters together. And so those are principles of trying to keep infectious diseases from spreading. And this particular infectious disease is pretty highly contagious. We haven't seen as much of it down here because we're not as dense a population as Chicago or Detroit or New York or whatever. But I look at it in another way. I also say we haven't seen as much of it down here, which leaves us in much more fertile ground for the virus because we don't have any immunity down here. They're estimating now, I just saw something today where they're estimating in New York that there may be 20% immunity to the virus. And that's the highest area in the world that got the virus that we know of. And so our immunity to this virus down here is almost zero.
That's correct.
Susan?
Okay, but that then takes me back though to, yes, it's contagious. However, what Don was saying on the enforcement on what you would have to do on the morbidity and mortality rate and things like that, that number isn't that high, even though it's a very contagious virus. So I guess it's kind of like a, you know, catch-22 in a way. But I think that what we need to do here is to, and going back to the comments about the other municipalities and the other counties and stuff like that. But I think in McLean County, I think that what even the city and the town and are looking for is the guidance from the health department, from the Board of Health, as to what we feel is the way to move forward, because they want to move forward. And it's not just, you know, the county board, it's all these other jurisdictions too. And I think that that's what they're looking for. So I think that if we look to see how we can move forward with that, and that's why many people are looking at the HOI plan to be the vehicle to move us forward. Because then you're starting to get into some mental health problems too. With it, the longer this goes on, and we all already know that there's increased mental health issues with people just because how long this has gone on. It's only been 2 months. So I think that we have to also look at that, because we're also in that business too, and we have to be watching out for not just the virus issues, but we also have to look longer term onto the mental health impact, short term and long term of this whole thing. So I think that there's a lot of other issues, and I think that that's why they wanted some guidance from the health department and say what is acceptable. In the bar issue, you know, do we want to make any recommendations saying, well, the Heart of Illinois plan, Jessica said it could be tweaked. Do we want to say, well, we really want to tweak this part of it because, yeah, you can have indoor dining, at 50% capacity but maybe not people at the bar kind of thing. So I don't know if there's tweaks like that we can recommend to that, or that we can even recommend, moving forward. So that was
Dr. Janetti, I wouldn't be in support of tweaking any of the plans because, some of these recommendations it's truly a moving target and a shot in the dark, and nobody really knows the effect it'll have any of these recommendations. And I realize we have to make, try to get the country back open, but, I think that's probably maybe beyond the scope of the health department. We need to try to interpret the recommendation, what we think is safe to do, to help the county department make the decision. So, the reality of it is the R naught of this disease, which is, if every one person infected, how many people spread it, it's been 3, it's been as low as 1, okay, depending on all the social distancing. So it's not the flu, okay? It's much more contagious than the flu and much more deadly than the flu, by far. Okay, so we look at, it affects the elderly, of course. Younger people are pretty much, survive well with it. I mean, those are the realities, but it will spread the more we put people together. And so I think that, we have to, I think any guess on what's the proper number, 50, 70, or 100 people, I think that's just an educated guess. There's not much science behind it. And I think that, there's going to be a little risk no matter what decision we make. But I think to assume there's not risk in opening up from this disease, there is, and there's risk in not opening up. And I appreciate that. But it is contagious. People do get ill from it. And Dr. Ginsburg and I can surely attest to that.
This is Judy, Carla.
Okay.
Yeah, in fact, I'm reminded as I'm listening that it appears to me from what I've read and heard relative to the county board's expectation that they were really wanting us to share with them any concerns or reservations or questions we have. And in terms of giving some direction to Jessica, it would seem to me that some of the things we're talking about appear to be some reservations and some concerns and some questions that we should be sharing with them to inform them as they make the decision whether to adopt this and move it forward or not. I think that's what they're asking from us as the public health experts, and what is doable, what is safe, what from a public health standpoint is a good idea and can be is solid and best practice, and what can we actually do here or what can we not. I think we need to help them. We need to inform them, starting with Jessica and then to the county board as to what we think we can do, and that's what they've asked for, I believe.
Bob, hang on. Bob, did you want to talk? No, okay, I'm sorry. I thought I saw you raise your hand. Hannah, go ahead.
I guess, and I appreciate what you're saying, Judy. And unfortunately, I think that it's going to rely on the health department to implement the plan. And, to be honest, I know there are a lot of businesses anxious to open, but we have to be able to say that we can deliver on this plan. And I think the doctors, it's sounding to me like, are saying, well, these metrics are great, but anytime you put people in close proximity, there's a risk of transmission. I still go back to my original question. I'd really like to know where McLean County stands right now. Are we even within those phase 1 metrics? And I think we need to know, we need to have a baseline, and I think we should not move until we know that we are at that point. Now, we may tonight decide we're not recommending it at all, but I think I need to know, are we there? We shouldn't presume that we are in phase 1, stage 1. I don't know. I mean, I know, for example, our rate of infection is not going down. I mean, we're having new cases daily. So I don't know where we stand. I don't know that we even have the data collected to do that, but you know, it's a nice laid out, here are the metrics, here's the weighted percentages. Okay, are you green, red, or green, yellow, yeah. Green,
Red,
yellow, red in these areas. And I'd like to know, because I think we can't just start with saying we're ready to open and then assume that we're at phase 1 already.
And this is Judy again, and Hannah, I agree. In fact, my intent with my comment was not that we say this is or is not a good plan, but that we share with the county board and give the direction to Jessica that these are the reservations or the concerns or the questions we have relative to this plan. So that, again, I don't believe, and again, I'm not sure, but it was my understanding that we were not asked to approve a plan or not to approve a plan, but to share from a public health perspective, our reservations or concerns to inform the county board as they made their decision.
And that matches my intent. Hang on, let's Jessica have a second.
So the only thing I was going to say is, since the Heart of Illinois plan does start at phase 1, something that we could look at is more so, do we have the metrics to determine whether we could stay at phase 1, not necessarily, you know, what would get us to, because phase 1 is the beginning, and we're not necessarily looking to go from phase 1 to phase 2, but we're looking at, would we be in the red in phase 1, I guess.
Right.
That would be
Yeah,
the
I see what you're
only
saying, yeah.
determinant. And again, I don't have it for the sub-region. And I'd have to do some different math, since it's worded differently than Restore Illinois. You're looking at greater than 80% of total ICU beds in use. We don't have that, obviously. So yeah, I mean, I would have to take this math and work it backwards into what would keep us in phase 1, I guess, for Heart of Illinois.
Susan.
Couple of things that county board members have relayed to me, and I think I've relayed some of them to Carla and Jessica, as to what they're looking for here. Is they're looking for, when you talk that you don't have enough capacity, whether it's on people to do whatever, if it was enforcement or if it was contact tracing, even though you've got money for that. What is, when you say you don't have enough capacity, you would need to hire people to enter data or whatever it is to actually implement this plan, quantify in dollars, people, so that we actually can understand and say, if you move forward with this plan, it's going to take this, and we can do it maybe at this point in time. I mean, maybe you can have a date. Maybe you'll say, I can't do this until I hire 5 people. And it's going to take me 3 weeks to hire 5 people, you know, and so that they have to evaluate that when they're looking at this kind of thing. So I think that is more what they're looking for. And then when it came to the testing, if we keep the site and we don't have to ever worry about it going away, we don't have to worry about what it would take to set up our own site, you know, and have the health department get trained and make, you know, but if that would go away, what would that entail? Because that is something that many of the county board members are very focused on, is the testing. And so if that site went away and nothing else changed in the community, what would it take to do that? And I think that that's what some of the things that they're looking for too, is that what can the health department do? What can it not do today? And then, you know, what would it take to actually do something that you can't do, that we want to do, that meets some of these metrics? And those are some of the things that I have heard from other county board members.
Sonia, did you want to talk?
Well, I was going to kind of roll this out, could be a misinterpretation on my part, but it had come to me that the HOI plan has a shorter timeline in each phase than the Restore Illinois. More like a 14-day versus a longer time frame. And so I think that's one of the things that our business owners are going to be concerned about is, do they have to go 28 days in this category before we can actually open up? And I haven't heard any discussion on it.
Go ahead, Hannah. Well, I'm thinking.
Sonia, I believe that the way the plan is written, it assumes we're at stage 1, and that would allow tomorrow, if it was approved, restaurants to open at 50% seating capacity.
That matches my understanding.
I think it's moving from 1 to 2 to 3 that has that 3-week time frame, and I guess that's why I come back to, are we even in stage 1 here? If we are, we are. I just don't know the answer to that. I know, Jessica, you don't have the data. I wouldn't expect you to try to answer that question this evening.
Yeah,
But
it is going to determine it whether you would stay in phase 1 or phase 2, whatever phase. So 2 weeks would be that time frame of, if we met these metrics for 2 weeks, we would be in phase 1. Is that a question?
Yeah, I think to Susan's point, if we are to say, I mean, we do have an action item to recommend something on this tonight. So it's not just, so we can choose not to do that. But I think, one option would be to say, unless and until we are at stage 1, as shown through the analysis of the data, we stay where we are, which is, the Restore Illinois plan, and then we move forward through this plan. But I think we have to establish whether we are even there. And beyond that, I don't know whether, whether people feel that those metrics essentially match up with what the proposed opening is. What I'm hearing is there's concern that anytime you put people in close proximity to each other and you don't have, and I think Mr. Knapp has said it's going to be hard to enforce this as a health issue. We might find ways to do it through food permits or liquor licenses or other things. But there's some risk there.
And I think that we're probably in the same spot that a lot of people across the country are in. This is awfully uncomfortable to say, but we just do not know what's going to happen when we know that we're going to have to open. We can't stay closed forever for a variety of reasons. We all know what they are. So the next question is, does the health department have the capacity to monitor the situation and provide feedback to the county board so that if something goes wrong, if the worst case scenario happens and we have a huge outbreak, I'm not saying we're going to do that, but planning, if we have a huge outbreak, do we have a response plan so that we can not keep our citizens safe and not overwhelm the hospitals? Because those, I think, are, from what I've heard from other areas and what I've read in some of the articles, there's a lot of research. I can't believe how fast the research is coming out on this, because that's not the normal standard. But with all the research that's coming out in terms of treatment and what some of the nitty gritty stuff, and then how do you respond to things, that's what we need to either figure out tonight, or if you're not comfortable doing that, then maybe we need to think about what recommendations you want to put forward to the county board and get those together in writing so that we can do this next week. Cory.
We've now been here almost 2 hours, and
Right.
we've had some great things to think about. But I think what we're being so bound by the plans, and I think we're missing the forest for the trees. I think it's been brought up that what we really should do is hone in on what are the true public health mandated best practices that we have to ensure we have in place, both for preventing as much as possible something, this blowing up on us as we open, and a plan for if it does blow up, we have that surge plan. But I think right now, what we are tasked with is trying to literally elucidate what are the key factors that we have to be responsible for, and that we have to tell the county board we cannot, as a public health body, feel comfortable until certain things are in place on our end. And so I feel like, can we spend about 10 minutes just kind of brainstorming what are those critical pieces of public health practices that we want to ensure we have a handle on, so that this goes forward in a very planful way, and not even kind of taking ourselves outside the plans right now and just thinking about what are those practices. And obviously, we've talked about testing, but let's spend just a couple minutes talking about what should our plan be for testing. And then obviously testing leads directly to contact tracing. So then how do we build the contact tracing? And then tell us, Jessica, how long is it going to take to have those, let's just talk about those two things, to have those in the shape we want them in to move forward. Does that make sense?
So, we've got plans probably 90% complete for both of those things for testing, and, knowing that the IDPH community-based testing site is planning to continue for an indeterminate amount of time. That buys us a little bit more time, but our goal was in the second to third week of June to try to have something in place where we are assisting our federally qualified health center with just expanding their testing capabilities. They've got something already going on, and just coming alongside them and being able to assist them with that. And then in terms of contact tracing, we've got obviously, again, the 6 that we have already that have been doing this, for their jobs. And then we have at least six more that we've identified internally. And then obviously with getting money, we're looking at what our needs are. So we're preparing for a surge, and it is difficult to put an exact number on how many we would need, but we want to be over prepared. So again, we're comfortable with where we are now with contact tracing, but we want to prepare for internally covering a surge, and then even going beyond that. So the plans are there, and again, even in their written forms are 90% done.
So what are you projecting? I loved how you just gave us some really nice definitive information, and you're really talking about second to third week in June. How about for the contact tracing? That was for the testing pieces. And then also, will you speak to, do you think the FQHC, Chestnuts FQHC, will that meet the need of citizens that maybe are going to have trouble getting out to the current location? Do you feel like, or do we need to be looking at like a mobile site? And what about our rural areas? Should we be having some sort of a mobile transport way to get to rural areas?
So the conversation that I'm having with the people that are facilitating the community-based testing site going forward, again, we're in the planning of this. I know it's soon, but we're planning for being able to have that as walk-up, offer that, and then make it mobile to where it's not just at the community-based testing site out at the interstate fairgrounds, that it would be in different locations in the community. And then that's the conversations we're having with Chestnut, as well as, they're looking ahead at how could they make what they're doing mobile if they have the partnership to come alongside them and, offer that personnel and that assistance with what they need.
And roughly when are you projecting that would be kind of fleshed out, including staff and, that Rough
Mhm.
timeframe.
Yeah, again, our kind of, our goal is for that second to third week of June. And knowing that we now have a little bit more time to really make sure we do this right. But, I don't know about the other testing site, about making it mobile. Again, I'm speaking to things that I know about, but I don't know all of the details yet about what's going to happen with this community-based testing site that's being continued.
Susan,
Go ahead, sorry.
Tammy. Hi, Scott. What's your dog?
That was Groot.
Groot? Groot?
He's very jealous of the time I'm spending with you all.
I can imagine.
Okay, give us a second to clear the conversations here. Yeah, he's got audio and video feed again. We're going to resume in just a moment. Okay, Scott, I think we're ready on this end. We are live again. You may proceed. Thank you.
All right. Apologies, everyone, for the technical difficulties. That's the life that we live in. So if I could recap where we're at, we're talking about what recommendations we need to provide to the county board in terms of implementing whichever plan they decide to do. Sounds like we've probably have capability right now to do 135 tests a day, but we're really gonna need to up our advertising by mid-June, maybe, third week of June, to give us some, right, more or less. Then we'd have capacity to maybe expand testing a little bit, because we're all painfully aware that the McLean County fairgrounds site just is not the ideal site for testing, given, you know, the way our community is. And then for contact tracing, we've got funding from IDPH to hire some and get them trained. It's going to take a while to get folks hired and get them trained. That's because it does take quite a bit of training, and we also have some confidentiality issues that Jessica's been working with Ms. Woods to get that figured out. Because if you hire, that people need to be trained in terms of confidentiality. We kind of bandied around some ideas about hiring folks from the community. There's positives to that because maybe there's a little more trust, because that is an issue with our communities. But on the other hand, if it's someone that they know, then there may be some issues about confidentiality. So that's something that we're working on. We have the dashboard available to us. That sounds like it'll help a lot in terms of getting businesses, instead of them having to come to either Tom or the community folks or Jessica to get a plan approved. They can do a self-assessment, go through that process, get a certificate, and then we can monitor how they're doing in terms of enforcement, like we would with anything else. And there's a place for community members to put in complaints. Cory.
Can I ask a question about that? The self-certified compliance. So again, are we expecting, doesn't matter which plan is adopted, are we expecting every single business or entity that opens, they will have to do that self-certified assessment of themselves and then have that information available to their employees and to their customers that they have gone through that process? Is that a mandate that we are, as a health department, going to say that has to happen? And what kind of a time frame, what do we think it will take for businesses to do businesses already know they're supposed to be doing that? Do they know where to log on? I mean, or is that a whole process that we've got to put in place yet?
No process in terms of it being there for them to be able to get on and do. The process would be more of awareness and education that it is available, not as a mandatory certification. It is more of allowing them to know what the guidance and compliance would look like, and to show and work with us and collaborate on, here's what our expectations are of you, and you're voluntarily complying with that and showing us that you're doing it.
As a public health best practice, would we want to tell businesses that they should do that? I mean, would our expectation be that every business ought to be doing that? Or is that going to be purely, do it if you want? I think those are the kinds of things, the kind of recommendations we need to be giving to the county board. I mean, is that something as a best practice as a public health body we think that we should be strongly encouraging that?
Cory, can I just tell you that the metrics in the plan have 90% of businesses have completed and posted that. So there's a metric addressing that in the plan.
But that's just in one plan, right?
Well, I want to be clear.
But
I am,
that's what I'm trying to get outside of the plans. And that's what I'm saying. Do we as a public health body think that compliance, that self-assessment compliance is a good idea?
can I just, so I know where our discussion is going, please? I understand that Chuck Erickson's plan is not under consideration tonight. It sounded like from his letter that he wasn't promoting that any longer.
That's
I
correct.
assume- We already are under a Restore Illinois plan, so we have that plan. So Cory, you're saying, should we develop a third plan from the health department?
No. I'm saying, what do we, just in terms of good public health, as businesses start reopening, what do we think would be the best practice that would limit new cases? So would our businesses going through that self-compliance review process, would that help us believe that businesses had indeed, thought about their floor plan, thought about, how they're going to socially distance, thought about how they're going to, tell customers, maybe give them a mask when they walk in, all of those things. Do we believe from a public health perspective that the best thing we could tell the county board is to say, we think that would be a great way to prevent fewer new cases if our businesses had taken that step? And so should we be saying, go for that? And then what kind of a time frame is it going to take to get 90% of the businesses to have that done?
And that's one of the metrics that, is in my mind of can it be adjusted? Because we would like them to do this. It helps them know, again, what's expected of them. It helps us with our capacity to work on voluntary compliance, because that, again, will be something that is significant regardless of which plan we go on, is monitoring that compliance. So that is one of the metrics that I've asked about. And, if it's editable, we want them to do this, but I guess the 90% metric is to just ensure that they are doing it, and an encouragement that in order to stay in this phase of the plan, we have to have 90%.
And the carrot part for this is if they get their certificate, then that would help customers know, because everybody's just assuming everybody's dying to go out, and that polling wise isn't the case. So that their certificate would help them say, look, I've looked at the guidance is from the CDC. So I've looked at the CDC guidance. I've gone through this checklist of business owner. I've complied with what the recommendations are. And so I am using best public health practices to keep my business and you safe. Bob. Mr. Colhase. Go ahead.
Yep. Jessica, have you been invited to attend the county meeting next week to answer questions and present?
I'm getting a thumbs up back there, so I would say I have.
Okay. Wasn't trying to.
Viola's in the back of the room. Okay, so that's what you guys can't see. Her boss is in the back of the room.
Uh-oh. Well, I've taken a lot of notes and just some of my observations, and I agree with everything that people have been talking about. But some of the things that I'd like to promote to give direction, and I feel we've talked, looking at all my different notes, we've talked about all these different viewpoints. There's many facets. There's a lot of uncertainty that we're dealing with. There's things that we can't answer, things that we don't have control over. And really, I would like to steer us towards what do we have control over, and really give Jessica some direction. And what I'd like to see is more definitive. And I think, Cory, you highlighted that about, when we started about definitive things that are going to happen. And, I'm concerned about the metrics. I love the metrics, but we really get those metrics? So that's, and, that was talked about already. Is that data really there? And so my concern is, we really have two issues. If you ignore the political positions of different people, it really boils down to the what people want is businesses to open and have consistency and fairness in how they open. Where someone had said earlier, you have businesses that have crowded parking lots, so why can't other businesses open if they follow, masking and distancing and proper hygiene? So that's one issue. But from our viewpoint as policymakers for the Department of Health, what I would like to see us do is give some direction to Jessica of taking out discussion and say, okay, we are going to do this and this and this to move towards understanding our confidence that we can open up more businesses. And so I think that's what's missing is that I think we need to get past the questions that don't have answers and talk about the metrics. And I think it's really boiling down to, okay, what resources do our staff need, and are we supporting that in the correct way to get to a conclusion? And so our action item is to provide recommendation to the county board on the proposed plan. So I would really appreciate everybody's input so that we can do that, because I don't think there is a answer, but I would like to give some strong direction to our director.
And I guess if I can, some of the things that we would need, obviously my plan kind of shifted a bit today, learning about, the continuation of testing and a significant grant from IDPH. So as I look at that scope of work in that grant and the deliverables and the budget and what we can do, it'll help me reassess the plans that I had before today.
Internal plans, not community plans.
Right.
Right.
Yeah,
Why just
so
making
what
sure,
we-
because
what
we're
we
throwing the
need.
word plan around. Just want to be sure that we're clear which plan we're talking about.
Yeah, what resources do our staff need? It has changed a little bit in the last 24 hours.
Yes, Cory.
So to do what Bob's talking about and what I'm talking about, so what's the best approach? And I'm wondering, so should we say, so what additional, we started talking about additional staff and time to train and all that. So that's our recommendation to the county board is we need a certain amount of time to put training, to hire people and train them. And then do we also need to talk about, like what is going to be our, the department that, I can never think of the name of the department. It's the one that basically does the media, the health department that does the media, what do we call, so promotion, the promotion, sorry. So what do we need to have some sort of recommendations for what they need to do in readiness to get all the messaging out that we need to get if we're expecting businesses to do the self-assessment, if we're expecting, the masking and the social distancing message to be driven into each and every business, and how, like, should that be posters? Should that be, what are all the ways? I mean, is that already in the works? And tell us again, what does the county board need to hear in terms of what do we need in terms of social promotion to get all that out into the community as deeply as we're going to need to?
Do you need more staff to do that?
At the moment, no.
Okay.
No.
All right. Susan, sorry, I was asking questions.
No, that was fine. When you're doing that, and we're looking at what the needs are, whether it's staff or whatever, or supplies, I would like to ask you to also look at what the potential impact that would be going even into next year, even though we haven't done budget yet, because there will be an impact because this isn't going to end just because the year ends. And so with the money that you've gotten from IDPH, if that's only until X amount of time or just only a flat amount of dollars or a flat amount of people that you can hire. So then on the sustainability issue as to going forward, we're okay now, or we only need 2 people now, or whatever the case may be on any of these issues. But then saying, but those people aren't going to be just temporary. They're going to be for at least a year or till we have a vaccine or a treatment that we, can't go that. So, it could be a permanent position kind of thing too, because, the board is eventually going to have to start looking at a lot of other things budgetarily. And so this is a high priority item right now. And so that we want to make sure that it's very clear as to what the impact of this is, not just now to do like a budget amendment, but to do in the future. And my other suggestion is to be as specific as possible. I mean, because the county board, and I think you've seen in other meetings, they kind of drill down and ask a lot of questions. So I think if you give that to them in this, whatever you write up and everything, that the direction that we give you, so that they have it when they have their packet, and so that they can digest it, and instead of asking questions that are already there or they haven't thought through or whatever, is going to be very beneficial to everyone.
Sonia, go ahead, Sonia.
I think our business community is really looking to hear some direction from us as to what the county health department can do. And I'm very encouraged by what we've heard tonight about people that we need to hire, that we're maybe 90% there in a couple of areas, that you've got some new funding. And that helps reassure me that we're probably, as a health department, moving on the right direction. And at that point, I think the businesses need to be partners in this process and understand their role in carrying this out, that it's not just open your door and business as usual like it was in January. So there's a lot of work, Jessica, that you and your team have done. And I'm particularly grateful for that. And I believe as the county board addresses this, they're going to need to also talk back with the business community through all the avenues, chamber and all those places, to be a partner with us. So I'm hopeful for that.
Thank you. Hannah, go ahead. I thought Judy wanted to talk, but never mind.
I don't know if that was Judy trying to talk or not.
That's
Okay,
what I thought. Then
so a couple things. One is, oh, maybe she does. So I think that, we have to realize that the county board has an item up for vote on, and yes, things can change probably, hopefully, based on our input to whether to adopt this plan. And so tweaking or whatever, I think we need to look very carefully at what this plan requires. And I think the only way I can support it is to know that we will really follow it to the letter. And there's a lot in there. And I think we've addressed some of the resources that we need to do that. I don't think we've really gotten the enforcement piece. If you look at the plan, it talks about develop a system of enforcement with, notice and opportunity to secure, et cetera, et cetera. I don't know, staff-wise, who those people are who go and check. Are we going to do spot checking? Is it going to be complaint-based? That's usually the way we work, but in this case, we might want to, particularly in the beginning, do more actual walkthroughs of businesses. So I think we need to add that to our list of staff or resources to do that. And I would say that, I feel like we need to set a standard that says if the county board passes something on the 28th that says we want to do this and we do it tonight. Clearly, from what we're talking about, the health department is not able to follow the plan that immediately. So I think anything that we recommend tonight, because I think unless we say we don't like it at all, we're basically giving our tacit approval to it, is that there's no implementation until we're fully staffed and ready to do it. And also, I'll go back to my request that, that our metric, we've scored ourselves to show we at least meet the phase 1 green standards. And then I guess if we say that, then we may be pushing back the time, to which point we may dovetail in with where we are with the Restore Illinois. So we may be doing a lot of work and then end up timing wise no further ahead than the existing state of Illinois plan. So
Judy?
Yeah,
Awful lot of. Is there anything we can do to help her or no?
I mean, it looks like she's in twice there.
Okay, go ahead. Oh, I see what you're saying. You're right. She
yeah,
is.
I lost it. Never mind.
2 phone calls or 2 connections into the meeting.
Judy, he's saying it looks like you've got 2 connections into the meeting instead of just the one. Who else? While he's trying to help her with that, Susan?
My concern is that the governor's current EO ends the 28th, I think. And that is when we're meeting. And the courts open up June 1st. And I have a feeling, this is just my opinion, that after June 1st, I think that there's going to be businesses that open anyway. And they'll wait till maybe the end of the month. And I guess that trying to say we can't do this until a certain date, mid-June or whatever, I'm not sure that that's going to work either. Just based on some of the things that I have heard from businesses. And so I guess that, yeah, we can say to the county board that, but also be prepared for other actions.
Right. And we can't control the courts. We can't control the community. We can ask the community to be partners with us, because if we don't do this as a partnership with community members and businesses, we're going to look like a lot of other places, and it's not a pleasant place to be. So we all are going to have to work together. We're all going to have to wear a mask to protect our mothers and our fathers and our grandparents. Because we care for other people, we wear a mask. I mean, that is kind of the messaging that has to go out. So, I don't think we're going to be, we're running out of time. So I don't think we're going to make it's almost 8 o'clock. I don't think we're going to make a recommendation tonight. We can't. Would you guys be willing to meet briefly next week if you had something written to look at ahead of time? Yes, Susan.
I think that we can, Jessica can take what we've given her and the input that she's had from everyone, and write up something for us to, you could probably just send it to us and not do it, as an open meeting violation kind of thing. And just say, this is, what we've come up with, what we've come up with. But I think we need to trust Jessica to come up with, to use her discretion and knowledge of what we've said to her to write a recommendation based on what we've said. I think that we all kind of were able to verbalize what we, felt and the issues that we have. And it might not be yes, do it, no, don't do it. It's just like, this is our position on that. You know, as a, this is, if you vote to do this, this is what it takes. If you vote to not do this, you know, we still have to do this, you know,
Right.
other things. So.
Bob? Did you want to?
Yeah, I just want to really emphasize what other people have said. I think, Jessica, one, we are 100% behind you, but we are at a stage of how we communicate. And I believe Susan also said businesses and others are looking for direction. And so the power of the communication that the health department provides, that's one aspect of this going back to more normal. Again, we don't control the biology and the viruses, but we can control, you know, our hygiene and minimizing potential infections. So if you would think more in terms of implementation and what direction we give people and businesses, I think that's where we're leading. And the plan is a subset. And I think I said last time, Susan, that at some point the timing, these things could merge together because things are rapidly changing. So I just want to let you know that we're behind you, and you don't hesitate to reach out to us.
Thank you.
Is everybody agreeable with that plan? Cory?
I would just ask Jessica, what else do you need to hear from us? Is there anything else you want us to weigh in on that would be helpful to you?
So I just want to clarify, you're looking for me to have a written recommendation for the county board, and really in that containing our plan to implement reopening plan and what that would take and sustainability, correct?
I wouldn't call it a reopening plan. I would say that it's a description as to if this choice that the county board makes, if that is your decision, this is what the health department requires of the county board, what the health department is asking for the businesses to do, and asking what the health department is asking the public to do. And it doesn't have to say that we're endorsing the plan necessarily. It's just saying this is the requirements that we feel are necessary to go forward. And Hannah's shaking her head, so she's gonna.
Public health practices for us to go forward. Hannah?
I'm just sorry, I'm just really confused. I mean, we have the Restore Illinois plan. Now, we haven't really talked about whether we think that's an adequate plan or not. Sounds like what you guys are saying is there's some other new plan that we are going to formulate for the county board, or the county board may come up with a new plan. I want to be clear first that we were asked to review this Heart of Illinois plan, and I think our response to be, and I think Jessica can do it just fine to go through, but go through it. I mean, it's saying develop this thing for businesses to use to self-certify, and I get what you're saying, Jessica. We really don't know that that's necessary, but it's in the plan. So if we have to do this point by point or letter by letter, because otherwise we just have not a plan. So I'm not quite sure what this other messaging is in terms of, other than just good public health messaging about what's safe practices to engage in. But so I'm a little lost in whether we're just saying, we've asked to look at the HOI plan, here's how we see it impacting our operations and what we need to really be the people who guard that we do it. And maybe that's the same thing we're talking about, but I'm a little, I mean, I think start to veer off of that, then I'm not sure what we're doing.
No, I think that's my understanding. Does that match what you're thinking? Okay. All right, so I'll say this one more time. So Jessica's going to work up some recommendations about where we are, where the health department is. And, you know, really, it doesn't make any difference, which I'm not talking about making another plan, but we can support the county board with these conditions, right? So we have, my big concern is alleviated. We have testing capacity. We're going to work on improving that. We need to work on contact tracing. We have funding for that, but we're going to need to hire staff. We have a mechanism that's not in place yet for businesses to do a self-assessment that will provide some assurance that they're following public health best practices. And that will alleviate some of the issues, some of the concerns that have been expressed with, you know, just in terms of capacity for the health department to have to review. There's a lot of businesses in this county that, especially restaurants, that, you know, to make sure that they're opening and that they're following CDC guidance. Did I miss something?
I guess my
Enforcement.
Yeah, and so my only clarification would be, am I looking at what we would need to implement the Restore Illinois plan or the Restore Heart of Illinois plan, or both, or just what?
Either or, whatever
Okay.
it would take.
Okay.
Again, I think best practices, I mean, whatever you feel like best practice wise must be incorporated.
Okay.
But I want to be clear, because the county board has asked us about the HOI plan. And I think it muddies the waters to say, and this is what we'd have to do for Restore Illinois. That's already there. You know,
Right.
The HOI plan is not. And I think we need to be very, very clear in providing a response to the HOI plan, which is what we've been asked to do. And, you know, it's being sold to us as a plan that contains a lot of safeguards to ensure safe openings. So all those metrics and all those things are in the plan to say, if you do this and you can establish that you've done that, then we should be okay. I'm not the person qualified to make that judgment. What I think we have to do is say, if we actually, and that plan is good and we follow it to the letter, do we have staff capacity, et cetera, to do it? And that's really what I think the county board needs to hear, and then know, well, if we don't, then this is what we need.
Right. Susan, we need to wrap this up, guys.
Yeah, no, I want to clarify, it has to be the HOI plan that we address, because the actual special meeting was called specifically for the HOI plan. And that's the way it had to work when they sent whatever letters were sent in. And it had to be very specific, it was very specific. So it is the HOI plan that we're looking at.
Right. Then she'll specifically address the yes, Cory.
Do we then, if we're going that way, not just focusing on what best practices what public health practices do we want to make sure are present, no matter what the plan? If we're going to go HOI specifically, do we need to point out the areas of concern within that plan? The areas that give us pause, the areas that make us think, if we do this, you know, we caution you about, as the doctors have mentioned.
Yes.
Yeah. Do you feel comfortable doing that?
Mhm.
Okay.
And I mean, I'll be sending it to you guys first, obviously. And I mean, will there be something after that, or will it just go directly to the county board from me, knowing that you guys have seen it?
Do you guys feel like we need to meet one more time, like you'd have to be on I don't have my calendar, Tuesday, Tuesday's the 26th, right? Wednesday's 27th. And they're meeting on the 28th, but they need the packet more than 24 hours. So we have to meet on the 26th. Yes, Susan.
48 hours.
48. Thank you. Susan.
I kind of, if you send out a draft to us, that maybe we could just provide you feedback individually, and then provide it to the board for the packet, for the board packet, county board packet, so we don't have to meet, because I think that that might just be another challenge for everyone.
Right.
And so I think that maybe that might be the route we can go.
Okay. Is everybody comfortable with that? Okay, let me rephrase. Is anybody?
I am if Jessica is, because I feel like in a way we're handing her a lot, we're putting a lot on her shoulders. So if she's comfortable with it, I am.
Well, I mean, some of the things that I brought to you tonight were already the beginnings of that, of saying, you know, the 3 things that we needed, and here's where we are already. So it's there, just it's more so putting it in a document for you.
And again, are we going to ask her to put some timeframes to that as well?
I think
I've got timeframes
Yeah,
on
she's
some
got
of them.
timeframes. I feel comfortable that she has timeframes, and I can help her with if she needs word spending.
But I think Cory's asking is, with respect, if the county board acts to approve this, I mean, are we saying we'd be comfortable with it becoming effective May 29th?
I mean, I don't want to speak for the board, but if I'm saying that in my recommendation, we are able to implement it, then would that be the recommendation? That we could then implement it on the 29th.
Do we have the staff capacity to do that?
That's my
We don't-
concern. So the answer would be no. Right? I'm reading your body language and.
Well, we have the staff capacity to do this. It's more so now the planning ahead, and planning for, like you said, the surge, and looking at the things that we are already putting into place, the plans that we're
Right.
putting into place. And so do we have the staff capacity to implement this plan? Yes.
Okay.
We don't have an enforcement plan in place. I mean, if we read the details of the plan, I think there's some things that maybe we could do by the 29th, but I mean, I think we have to be very, very tight and say, every point that that plan calls for, are we ready on the 29th? I mean, I realize our usual MO is to be really helpful, but I think, you know, this is one of the things, there's been some concerns about some of the opening up express that, you know, if the plan works, it only works because we follow it to the letter.
And we have a lot of cooperation from the community. And that's basically what it's gonna take. It's gonna take folks being responsible, and we can't do it by ourselves. Cory?
If we have concerns about certain types of businesses opening, like, let's say bars, because we've already mentioned that, is there a need, is in part of what Jessica would prepare for us? Is there a need to say, what would we need to do in meeting with bar owners to reduce the risks as much as possible? Are we, you know, is there some extra thing that we need to do for those businesses that make us more concerned about their challenges?
So we have a complaint and compliance plan in place. It's one that we use already for, you know, especially environmental, whenever they follow up and work towards voluntary compliance. So we have that, you know, step-by-step process already in place. It would be making sure that if we implemented a plan different from Restore Illinois, that our business owners know the expectations of them. And so that's what I would be looking to get out to them is, yes, in this phase, wherever we are, this is what can happen. You can be this type of business at this capacity. And then, yes, letting them know exactly what our enforcement policy and process is, being very transparent and clear.
Is there a need to have any representation from those higher risk businesses? Do you have any kind of a meeting or planning process above what we would be doing, other than just telling them what the enforcement process is? Or is there a need to, you know, have some representation, meeting with them, saying, because you present higher risk, just by the nature of your type of business, do you see what I'm saying? Is there anything above what we're doing with other businesses for those higher risk businesses that we could do that we would feel as a best practice would perhaps minimize potential contagion?
And CDC has risk mitigation guidance that's out there. It's been out there and they've edited it recently where it looks at different types of environments. So that's, I guess we could share that with them. Again, it's based on, yes, what type of business do you offer and what's going on in the community? Do you have, community transmission and then what's your risk and what you should be doing at that time?
Okay, Susan, guys, Susan,
I'd like to call the question.
thank you. Judy, do you want to say something really quick before she does that? Well, because Judy's had issues. I mean,
Yeah,
all right.
the bad news is I'm battling an old browser and my new computer arrived today. But anyway, since we're calling the question, could someone repeat that for me?
Sure. Just
About the CDC risk mitigation?
no,
or,
I think about what you're going to do.
Okay, so
Briefly.
Okay, yeah. I am going to write a recommendation to the county board of what resources the McLean County Health Department would need in order to implement the Restore Heart of Illinois plan.
Thank you.
And she's going to send that out to us.
Could you also include a time frame for implementing those different functions? In other words, are we ready immediately to do these things?
Right.
I mean, we may not need resources to do them per se, but we need to develop.
Long term, we're going to need resources.
But it's also how much time does it take? And, within the plan, there's a lot, like, for example, it's a little confusing to me when it says generally 6 feet separation, but then bars are open and I fully agree it's going to be hard to stay 6 feet apart.
Right.
So, yeah.
And this is Judy again. If I might just add, in fact, I just sent Carla a text, which she may be receiving now. I support the idea of the timeframes because that gives it some context. And I also wanted to urge Jessica to include the importance of all of our community partners, who we currently have and who we need, because this sends a message, I think, to the community that while we are taking this very seriously and are looking out for the well-being and safety of all of our citizens, that we do need our partners to be a part of that effort.
Okay. Is there a second? Sonia? So we have a motion and a second. Jessica's, no. No. Hannah, what is the matter?
Did somebody make a motion? I did not hear that. I'm sorry if I did. I missed it.
I'm sorry, Susan, did you want to make a motion? I forgot the current question is not a motion. You're the one that called the question.
Oh, no, I just called the question so anybody can make the motion.
Okay. Sonia. You have to unmute yourself. Okay.
I'll make the motion to accept the plan that Jessica has just reiterated to us about writing up the plan, distributing it to us to define what are the conditions, circumstances that the health department is looking to fulfill.
For implementation of the Heart of Illinois plan.
Exactly, for the Heart of Illinois.
Is there a second to that? Dr. Ginsburg, is there any more discussion? All those in favor?
Aye.
Aye, all opposed?
Aye.
Any abstentions? All right. Is there any other business tonight? I hope the answer is no. Tammy and Kim and Tom and Kathy and Jessica, thank you so much. I can't express my thanks. And thank you guys for being here. Have a good night. Have a safe Memorial Day weekend, sorry. What holiday are we supposed to have?
Thank you, Carla.
Thank you.
Good night, everybody.
Good night. God, you guys, thank you so much. Appreciate it.
Okay.